Surgeons have been staring at blue fabric during operations since the 1960s, and the reason has nothing to do with cleanliness, sterility, or hospital branding. It's about what happens to the human eye after 60 seconds of looking at red. Here's what you'll learn: why the color red fatigues the eye faster than any other, how a phenomenon called the complementary afterimage nearly caused surgical errors in the early 20th century, why green scrubs and blue drapes solve the same problem from two different angles, and why some modern operating rooms are now reconsidering the whole thing. For most of medical history, surgery looked the way you'd expect it to. White coats, white sheets, white everything. White was clean. White was professional. White meant you could see contamination immediately. And for the early days of surgery, when sterility was a new concept and the biggest problem was infection, white made perfect sense. Nobody was thinking about eye physiology. Surgeons were thinking about carbolic acid and whether they'd remembered to wash their hands. But as surgical techniques improved through the late 1800s and early 1900s, operations got longer. A procedure that once took 12 minutes now took 2 hours. And surgeons started noticing something strange. They'd look up from a wound, glance at a white drape or a white wall, and see a green or teal ghost shape floating in their vision. Not a smear, a specific afterimage, and it was right where they were about to cut. This is the complementary afterimage, and it's one of the more well-documented quirks of human color perception. Your retina contains 3 types of cone cells, and each one is tuned to a range of wavelengths. The ones sensitive to red and green are clustered most densely in the fovea, the sharp focus center of your vision. When you stare at a saturated color for more than 30 to 45 seconds, those cone cells begin to fatigue. They deplete their photopigments. Then when you shift your gaze to a neutral surface, the fatigued cones fire less, and the unfatigued ones fire more. The result? You see the opposite hue. Red produces a green cyan ghost. Green produces a magenta ghost. Blue produces a yellow one. A surgeon staring into a blood-red surgical field for an hour, then glancing at a white drape, will see a shimmering cyan phantom. It lasts 2 to 5 seconds. During that window, their color discrimination drops. In a field where distinguishing an artery from a nerve from a tendon by color alone can matter enormously, a 2-second visual glitch is not trivial. The fix came from 2 directions simultaneously. In 1914, a surgeon named Harry Sherman reportedly started wearing green scrubs instead of the traditional white, specifically to reduce this afterimage effect. The logic: if the neutral background isn't white but green-blue, the afterimage from a red surgical field lands closer to the ambient color. The ghost blends in instead of popping. Blue and teal drapes followed the same principle. Blue sits opposite orange on the color wheel, not opposite red, but it's close enough that a blue-tinted drape significantly reduces the perceived contrast of the afterimage compared to a white one. It doesn't eliminate the afterimage, but it makes the ghost less distracting, less saturated, less likely to cause the surgeon to misread what they're seeing. The specific shade used in most surgical drapes, that muted, dusty blue teal, is not arbitrary. It's landed in the range that best balances low afterimage contrast while still maintaining enough visual distinction from the patient's skin and tissue to be a usable reference boundary. Now, here's the deeper layer. The blue color of surgical drapes also interacts with the color rendering of surgical lighting. Operating room lights have historically been designed to maximize contrast in the red to pink tissue range. They're bright, slightly cool white lights, often pushing into the 4,000 to 5,000 Kelvin range. Under that kind of light, a pure white drape becomes almost luminous. It creates a glare border around the surgical field that actually makes it harder for the eye to adapt between the bright field and the surrounding area. Blue fabric absorbs more of the blue spectrum light, reducing reflectance. The drape becomes less of a glare source. The surgeon's eye doesn't have to constantly readapt at the periphery of their vision. This is the same reason photographers use dark gray or black lens hoods and camera bodies. Reducing stray reflections at the edges of the field keeps the center of attention cleaner. The failure case here is instructive. In the 1990s, several hospitals experimented with cost-cutting by switching to lighter-colored or even white disposable drapes. The material was cheaper. The sterility performance was identical. But in post-procedure surveys, surgeons consistently reported more eye fatigue on long cases. One study published in the Journal of the American Medical Association in 2007 noted that operating room color environment directly correlated with surgeon-reported visual fatigue scores at the end of procedures longer than 90 minutes. The white drape trials were quietly abandoned, not because of infection data, because the surgeons were tired and annoyed and said so loudly enough. The wider principle is everywhere once you know to look for it. The reason snooker tables are green. The reason broadcast news desks are often gray or blue-gray rather than white. The reason artillery spotters in World War II were trained to look away from their target periodically and stare at green vegetation. All of it is the same problem. The human eye, when locked onto a specific color field for long enough, starts lying to you. The fix in almost every case is the same. Neutralize the ambient surround with the complementary hue of whatever you're staring at most intensely. Surgical drapes are blue because human eyes are fragile instruments that wear out mid-task, and someone in the early 20th century was paying close enough attention to notice. The color isn't branding. It isn't tradition. It's an optical correction baked into fabric. If this is your kind of thing, the why behind the everyday object theory drops new ones Monday, Wednesday, and Friday.